Assalamu alaikum. Hello, everyone. How are you? Look, my name is IRFAN Hashmi, and I'm connected uh, from Australia, Adelaide. And I'd like to say thank you very much. Special thank you to uh, University of the Punjab, Professor Sayyid Atif Raza Sahab, and organizing this event and inviting me to speak about the program which actually for revision of the curriculum. And also I'd like to say thank you to Dr. Fatma Rasool, the chief organizer of this symposium. Thank you very much for giving me this opportunity. I'll be very quick with my points, with my dot points. Look, I'm a practical pharmacist, and I like to mention about some practical aspects of pharmacists who are actually studying in Pakistan, especially in Punjab University, that what are the elements which they need to know at their pharmacy school, especially those students who are actually entering in the first year. They should be given an opportunity to understand about some practical approach that what pharmacy student can do. First of all, they should know that as a pharmacy student, they need to be working at least somewhere 25 hours a week in a community setting, in a community pharmacy, where they can learn the practical thing other than their study work from the university, which is a very common thing in all around the world. Especially if I talk about Australian pharmacy graduates, they go and work in their first year. They work in community pharmacy, they serve patients, they discuss all the pharmacy job descriptions. They know a lot of things from the first year. So this is what is actually need to be assigned as a pharmacy college, as a pharmacy school, that they should encourage them. And how they can encourage them, they need to teach them some basic things like some of the students who actually going to work in pharmacy, they should be trained on first aid and CPR training, which any health professional need to do when you're working in this country. So how to save a life in case of any anaphylaxis reaction happen in the community or at work or in the pharmacy or outside the pharmacy, they should know how to save someone's life. So this is a very basic course that all the pharmacy professional has to do from the very starting point. All right. So this is a course which pharmacists need to do, and they have to maintain their certificates. As a pharmacist, as a pharmacy staff, as a pharmacy assistant, we need to maintain our certifications for the time frame where we're working in the pharmacy. So pharmacy students should be trained in the first year. All right. The next point is that mental health first aid. Look, mental health has become a big issue around the world since the COVID hit. Before that, we were not talking about mental health that much commonly. So I would request that there's a course available which pharmacy students should be trained or need to be trained in the first year, so they can be helpful in their initial stages, because these courses are actually given, or pharmacy assistant also do that, pharmacists also do that. So why not pharmacy students can do that? And in Australia, pharmacy students do this course, and they also do the first aid and CPR course and first aid and mental. They are two separate courses. So that need to be done in the first year. And after that, because when they're going to work in pharmacy, they should know a little bit about basic diseases, basic health conditions. For that purpose, I have a list of some health conditions which we call self-care cards. So there are 100 different health conditions which I would suggest that this should be given in the course in the first year. They can learn about minor elements like what is depression and what are the question and answer that as a pharmacy staff or as a pharmacy student they can ask, which will help them when they become pharmacists. They will be using these. If they learn this in the first year or second year, then they will be using that information in their work. and they will be more confident when they come out as a pharmacist. So these are the minor elements of 100 different diseases like cold and flu, hay fever, allergies, and different minor elements like what are the questions that we need to ask, especially when we interviewing a patient on the counter, pharmacist or pharmacy staff or pharmacy student. Pharmacy student or pharmacy assistant are the first person who actually come into contact with the patient. So they need to know how to check, how to assess, how to respond, and how to explain and how to record that person who is approaching to the pharmacy and asking about a medication. For example, if a cold and flu patient, if a cold and flu medicine has been asked by a person in the pharmacy students should be confident enough to know what are the appropriate questions they can ask, like who's the patient, what are the symptoms, have you tried any medication at home, and how long the symptoms persist, and any medication, any other health condition. So these are the things which need to be trained at the basic level. And these 100 health conditions, if we supply this information to our young students, I don't think that this will be difficult for them, but they will be very useful pharmacy workforce when they will be working 25 hours during their first year or from the first year. And there are certain documentation which is available, which I can provide. If these documents are given to pharmacy first year students, they can be very, very smart, and they can be very, very useful workforce in their first year, from the first year. And when they become pharmacists, they will be polished, they will be very confident when they become pharmacists. All right, and so these are the minor things which a pharmacy staff or pharmacy student, they do these kind of work in Australia when they're studying the pharmacy. But again, there are certain things which regulatory wise they cannot do, like vaccination, but they can assist in vaccination. I know that in Australia, we pharmacists do nearly 10 different types of travel vaccine and all sort of flu vaccine, all sort of COVID vaccine, and whooping cough vaccine and diphtheria, tetanus vaccine. So I would recommend that pharmacists should be given an opportunity to learn about vaccination training programs during their during the pharmacy course. And also the communication course should be added, where they can introduce themselves nicely, they can write a good CV, and they should have some good social media skills, because at the moment digital media is also very, very important for gaining knowledge and getting upgrade your your career. You can jump into your career by, if you have a good social media skills, LinkedIn and CV writing, and also communication skills, like how to communicate effectively, how to present themselves effectively when they're introducing themselves to professional people around in the environment. And other than that, I found that the status of pharmacists is quite low. How we can upgrade the status of pharmacists? We can only do certain new things, like in COVID, pharmacists was not heavily involved in COVID vaccination or flu vaccination. Since COVID hit, pharmacist has played a significant role, and the maximum number of COVID vaccine were delivered by us in pharmacy by pharmacists. So that is one of the major element which actually enhance the role of pharmacist in Australia as well. So I'm just thinking the same way, that if pharmacist trust can be build up, or pharmacist trust plus their acceptability and other health professionals can be raised, if we raise some of the job duties or some scope of pharmacists, if we can increase those scopes, we can bring the vaccination training, mandatory training in the pharmacy course, and make the legislation where they can be approved to provide flu vaccine, COVID vaccine, tetanus vaccine, and hepatitis B, A, or typhoid vaccine. If pharmacists start doing that, and if they are trained on first aid, how to save life in case of anaphylaxis happen, how to protect the patient from dying, so they can be more trustable health professional in Pakistan. And other than that, there's a very big area of pharmacy where pharmacists are actually confidently giving health services, especially in sleep area. Sleep health is one of the bigger issue that is not discussed commonly, but pharmacists and pharmacy staff provide their service as a health professional. So why not they can be replicate in pharmacies in Pakistan. Pharmacy schools can play a big role if they introduce this course of sleep apnea, introduction of sleep apnea treatment, and some basic trainings can be provided into their pharmacy college days. And this can enhance the knowledge, first of all, and when they become pharmacists or when they go to practical work, even if they're a student, because pharmacy assistant does this job in Australia, we call them sleep champion. So there's no much surgeon requirement that pharmacists need to be a sleep champion. A pharmacy staff can be that sleep champion. So pharmacy student can be if they've been trained. So these are the forms which actually we give to patient, and they come up with the answers, and we get this assist by the specialist, and we provide the sleep study at a pharmacy, which can be trained, and pharmacist or pharmacy student can be very useful with this sort of knowledge. And again, knowledge will be gained by these trainings. And also when they provide these, I would say when they provide this services in their practices, even if they are not qualified, even they will create a voice that pharmacists are doing more. Pharmacist scope has been increased. So that's something which need to be addressed at this level in this symposium. I would request that if these minor topics can be included into the curriculum, that can make a significant practical approach. Practical approach can be achieved by providing these. And in the last year, especially when pharmacists are actually coming out of the uni, they should be given an opportunity to train themselves for the overseas examination, especially like examination like CAPS, when they can be taught about how to study for those exams. And there must be an examination like MCQ examination based on CAPS exam can be arranged for the final year student, which I can provide some information, and that can be built up in their last semester or maybe in the final year, first year. So that can be a very good point for them, for anyone. Basically, they will be intellectual for international market as well. And when they go to for any exam, like exam for Middle East or exam for any other country, they will be more exposed to that kind of environment, and that will make a huge change in their future, because they will be thinking out of the box. They will not only just making themselves ready to work in industry-based jobs or in hospital-based job, but they will be ready to work in community pharmacy as well. All right, thank you very much for Dr. Fatma Rasool and Dr. Syed Atif Raza Sahab. Thank you very much for your invitation for me to talk on this topic. I hope I have served this purpose, and hopefully we'll see you again. And thank you very much for the entire faculty at the University of Punjab. Rizwan Yar Saab, thank you very much. And we'll see you soon when I'll be back in Pakistan and let me know if I can help further in any other symposium. Thank you very much for your time. Thank you. Thank you.